Hello, welcome today. This is my February ED chat. Happy to have everyone join us. I want to introduce Laura Gully. She is with Generate Health. And Laura's going to be here talking with us about Black maternal and child health, all the things we need to know, and all the things we will be interested in knowing and how we can help and making sure that we're supporting their efforts. I do want to let everybody know, very excited that Generate Health Flourish is a new partner of the Diaper Bank this year. We've had some we worked together before in the past, but we're working together in more a formal way this year. So we're so excited to have you guys be our partner and helping moms and babies here in St. Louis. So Laura, why don't we go ahead and get started? You can let us know what you do there at Generate Health, and then let's talk a little bit about, so we can learn about what's going on with Black maternal and child health.
Sure, absolutely. And Muriel, thank you for inviting me to come and just share and have a conversation about what's going on in Black maternal health and child health in our region. And I'm just so excited to be here because this is such an important topic that, it impacts everyone's life. And we're talking about, babies, we're talking about moms. This is at the heartbeat of our communities. So this is an important topic for me today. So I appreciate the invite. So just a little bit of kind of level setting about Generate Health. We are a coalition that inspires the region to address some of our most pressing maternal and child health issues. And we help to kind of facilitate or kind of power an initiative, a regional initiative called Flourish, which addresses infant mortality. And we have this large, kind of bold goal of achieving zero racial disparities in infant mortality by the year 2033. And that simply means it takes all of us, like everyone that's listening in, that's a part of your constituents, our constituents are considered partners in addressing some of the challenges that our region has faced for decades, and hopefully trending in the right direction to address, so that we can get ahead of this and have a thriving region. So just wanted to maybe share a little bit about what's happening. My role with Generate Health, I've been with Generate Health for a little over 10 years, and I'm the Director of Community Mobilization and Advocacy, which is simply, we center the voices of those that are most impacted by social and health inequities. And we do that by lifting those voices up, but also providing opportunities to bridge and translate solutions and bringing the right parties together to address these pressing issues. So what are some of those issues you may be asking? So I really want to just start by talking about equity as a way to just kind of level set that we're talking about everyone having a fair and just opportunity to be healthy as possible. And that opportunity is not afforded to everyone in an equitable way across our communities. And when I think about what we're talking about, it is still, Muriel, this floors me to even say this sometimes, it is still the most dangerous place to give birth in the United States. Is still one of the most dangerous places to give birth out of all of the kind of resourced nations. And that floors me. And we're talking in the year 2022, we're still having these discussions. But, if we think about what's happening with maternal mortality and, our infant mortality, we rank 7 in the nation for maternal mortality. And that is something that we don't want to lead in. Like there's a lot of other things that we want to we want to lift up, but thinking about that in putting that in a context. And what's most staggering about that statistic is that 80% of those deaths are preventable. And that creates, to me, opportunity for us to look at what we can really delve into in creating a different outcome for folks. And so when we look at our infant mortality rate, it again is not something that we want to be, but we are one of the largest metropolitan areas that are leading the nation in our infant mortality rate. And that, again, is not something we want to brag about. But then if we break that down into how this fares for Black babies, we look at the data. A lot of we get a lot of questions that are focused on, why do you focus on Black moms and Black birthing people and Black babies? And when we break the data down into who is most impacted or experiencing this burden of these inequities, it points to Black birthing people and babies. And so that is why we are really focused on this effort centered around, really looking at some of those root causes driving those inequities. And so that is the focus and central of what we're doing. And, in our community, in our region, we have some of the best medical care in the nation, right here in our own backyard. And yet we still have the disparities that are out of, that aren't trending in the right direction. So we definitely want to take a look at why that is and addressing some of those root causes. So.
Yeah, thanks. Thanks for giving that synopsis of your work and a little bit about what's going on here regionally. What do you think will change the outcome for moms and babies? What do you think? Do we need to talk to our legislators? Do we need to provide more support services or education to moms or pregnant people, so that they can prepare themselves or know what questions to ask of their doctors or how to take care of themselves? What do we need to do to help?
Part of what I so love the question, so appreciate the question. Where do we start to address this issue or these issues? Because there's just not one. I mean, and that's part and parcel why the issue is such a complex issue. That there's not one organization, there's not one individual, a savior, if you will, or a silver bullet that can fix this. It is, because it's so complex, that it's going to take multiple perspectives, expertise, and resources to put a dent in the outcomes that we want to achieve. But here at Generate Health, one of the things that we do is center those voices that are most impacted by the outcomes that we're talking about, the inequities and those disparities. And so we have a community leaders cabinet that help to do a couple things. One is these leaders have come together to identify just what are the issues that are driving and at the root causes that if we address and tackle as a region can significantly improve those outcomes. And they helped us better understand those things. And so they pointed to a couple of things that I certainly want to share with you that we built and kind of bridged our initiative work around. One of them was safe sleep. There were disparities in sleep-related deaths in our communities that our community was lifting up to say, pay attention to these things and invest in these things and build advocacy and support and policy change and system change around these things. Safe sleep was one of those efforts. And well, I can certainly share with you some of the work that's happening around that. Another priority area that the community lifted up was quality coordinated care, which centers around ensuring that we reduce fragmentation and that the care that women and birthing people are receiving is quality, culturally congruent, and trauma informed. And that certainly equates to looking at our we have a home visitation collaborative that is partnering with community to understand how they can meet some of those needs and gaps. It's also the perinatal behavioral health initiative that we have that is bringing partners that are providing maternal mental health, behavioral health services to families that can address the needs where they need them. So not just providing what we think they need, but really listening to community on how can we provide care and services that really meet your needs. Some of the other things that also elevated were around the social determinants of health, which centered around transportation. Big issue if you think about for our community, just getting to and from appointments and kind of meeting your basic needs were critical for families. And then housing. I mean, these are like anchor things. They don't necessarily center around just your medical, services. These are your things that you would need everyone having access to. So meeting those basic needs, and housing was certainly another area. Safe, affordable, quality housing was another area. And so those things, and of course, racial equity in ensuring that those that are providing services, those that can really help bring the community around. How do we, provide culturally congruent care and services that meet the needs of those that are impacted? And that is part of what the Flourish initiative is centering. That community has helped us better understand and advocate around. And so what gets lifted up, Muriel, are what areas could we further invest in? Helping to identify policy opportunities to, create more, services that and programs and supports that really meet, communities' needs. And so these weren't things that we just kind of thought were good to have. This is what community said would make a difference in their health and well-being.
Yeah, and I think that's one of the things that organizations and people are starting to look at is, instead of guessing at what people need to help, actually asking them what they need and what would be helpful to them. I think that's a better way of doing it, including them in the conversation, instead of just saying, this is what we think you need, or this is what we're going to do for you, and here's this. So I think, that approach is what a lot of organizations and a lot of, initiatives are doing right now. So I applaud you on doing that.
Well, thank you. And I applaud you all for doing the work. I mean, you're on the ground level trying to meet the needs and the demands that families have. And diapers is one of those central areas that, is hard to replace. Hard to replace, and the need is certainly there and continues to grow, especially when finances get pinched. And, as we were, still in the midst of this pandemic that has, really impacted, families that are, challenged with their resources. It doesn't go very far. And so, we are seeing the gaps and the pressure and the stressors show up in ways that are shining lights on some of the inequities a little brighter than they had before in the past.
Yeah. And we're happy to be just a small part of that, like you were saying before, where those basic needs things for us, diapers are basic needs for babies. So we certainly understand that housing, transportation, there are things that are big barriers to people being able to, have the care that they need. And those are certainly ones. So we, are very happy to partner with you guys in order to just be a small part of, of that, and making sure that we're being able to distribute the resources that we have, which is diapers and period supplies, and be equitable about it. So, looking at those families or individuals that don't have access to, these things and need access to these things, or, with diapers, some families who have their babies in childcare, they can't take them to childcare unless they have diapers. So, the packs of diapers that we give, and I know you guys give through the groups that get the diapers through your partnership with us, is really helpful for those families, because they can then be able to go to work or even afford, other things. Because if you're buying diapers for your house and for the daycare, that can add up. That's, a huge cost and a huge, cut in your income when you're not even making that much, to support yourself.
Absolutely. And I think that's the difference maker when I think about as you said, it's the little thing. Mm-hmm. It is a little big thing that contributes to either the difference between, okay, what am I going to do tomorrow? And having the stressors of how that impacts your mental health, your wellness, and your own thinking around what do you do to take care of yourself, to take care of your family. That is a pressure that you experience on a regular basis. When you can be thinking about other things, like, we talk about this mindset from, this mentality of, we're talking about some really tough issues that impact families' lives on a regular basis, like infant and maternal mortality. That's hard. Those are heavy topics to talk about, when we should be shifting that and talking about it from a growth mindset that anchors vitality. What would maternal vitality and infant vitality look like? And that mentality, or just that slight shift in focusing on vitality and shifting to what other things could families be incorporating into their lives to not just survive, but to thrive. That's what we're ultimately seeking to achieve. And, everyone contributing to, as you talked about, we do our little part. Well, the collaborative nature of what is necessary for families to get their basic needs met requires collaboration. And so that's what we hope to provide as, coalition, providing those conditions where collaboration can take place, and we can reduce fragmentation. We can increase opportunities to, for families to, enter it seamlessly throughout services and programs and get their needs met.
Right. So if people are looking to get involved with, with Generate Health or with the Flourish Initiative, what can they do to help with that?
Come on, the door's open. If you're thinking about, like, how can I contribute and what is my role? We can figure one out for you. If you have that a question in the back of your mind, we will help you with that. Because what I recognize, and we recognize as an organization, is that because it's such a complex issue, you may have expertise, experiences in areas that we could utilize as a community and as someone that's trying to address this effort. And there is a role for everyone to play. So I start by saying, you know, we ask this question all the time is, how are we accountable to the community most impacted by what the issues that we're seeking to support and address? You know, that simple question, you know, I am my neighbor's keeper. We do have an opportunity and in some ways an obligation, because we're all connected and interrelated when we're talking about the health of our region. So asking that question, how can I be accountable, is part of what can lead you down where you may need to go. And then the other piece is really centered around, you know, whose voice is really missing. You know, if as an organization or as an individual, you're thinking about ways that you can contribute and support work, whose voice is missing from the table. And we want to lift those up and engage. Sometimes our families are disconnected or disengaged for multiple reasons. I mean, either just I'm working, I don't have time, I've got all these other pressures and demands, to, you know, I didn't know how to get involved, or I didn't know my voice mattered. I mean, there's so many perspectives that we can certainly leverage, but everybody's voice does count and matter. If we're talking about our region, you know, being successful and significantly, you know, hitting that North Star goal of zero waste, like that requires all hands on deck. And, you know, we want to provide opportunities at the table for everyone. So if you are interested, we do have, we have monthly newsletters or things that we kind of keep you up to date. We call them e-blasts, but there's information that can help you understand what's happening at the advocacy level with policy. Who can you call? How can you make a difference? So you can get that information by going to our website at generatehealthstl.org and signing up to receive that information. You can follow us on our social media and track and follow, but you have a voice in advocating for what community says will be game changers for their lives. And so the community has spoke and has lifted up some of the priorities that they feel will contribute to their health, and ways that you can, you know, get involved. Contact us, please contact us, and we will help connect and link you to ways that you can get involved and engaged.
Thank you. I hope everybody heard that, and I hope they go and go onto your website and sign up. I know we participate a lot. Obviously, we're partners, but you know, and the things that Generate Health is doing for the community, and that's great. And I want to acknowledge your background. I didn't do it at the beginning, so I'll do it at the end. Happy Black History Month to everybody. And you have a number of notable Black women behind you. So that's great to see that history, you know, in the background as we celebrate Black History Month. And then I also want to early congratulate you on your 10 years.
Oh my goodness.
Who
would have thought, right? Like 10 years in, but celebrating 10 years. And, you know, when I look back, Muriel, what happened to the time? Like they say, time flies when you're having fun. Like it's been a pleasure to serve.
Yeah. Well, good. Well, Laura, thank you so much for being on my February ED chat. I appreciate it. You gave great information, great insight, a way for, you know, people to get involved and helping with your initiatives and helping with, you know, Black maternal and child health, but also just maternal and child health in general for everybody in the region. So I appreciate you coming on, and we will
inviting me. This has been great.
Great. All right. Thanks so much.